So here we have dynamic guided navigation for delayed implant placement. This is being placed in the lower left second molar. So the first step obviously is the planning. The AI on the software actually allows you to mark out the nerve so that it will do itself. You just have to verify it by checking, and then of course you place the implant. In this case, because the patient here has plenty of bone, we're going to go with a 4.8 by 12 millimeter implant. We're steering at least 2 millimeters clear of all anatomical landmarks. Anyway, so moving on, the next step obviously is the calibration. So you take your 3 tracer points to triangulate the precise position of where your drill is going to be. You need to give it enough anterior posterior spread so that according to the CBCT, the software can triangulate the position of your drill accurately. Once you've done that, basically you have to hold the tracer tip around the 3 points and then rotate it around the tooth or the surface that is there. In a full arch case, you'd use it on a screw, but here we've done it around teeth, and just make sure that that's done accurately. Next thing to do, of course, is check the accuracy. Once you've got enough points around those teeth, the accuracy will be pretty accurate, so it will be pretty good. So what you do is you tend to check it, on the precise cusp of a tooth to make sure that the cusp and the one you see are pretty much the same. Then of course you'll calibrate the drill, which we've done here, and then the next step is the actual surgical protocol. Now this was done flapless, so we've already drilled the made the tissue punch, and now this is the first drill that we're doing. So with that first drill, of course, you're trying to aim for the center of the bullseye, and of course once you get in, you can change the angle a little bit to try and get it precisely in that position that you've planned. It's very important to remember that you're supposed to stay within that box. So if you look either side of the bullseye, you will see a box where you've planned your implant. That's the box that you want to stay inside at all times. As you can see, again, we're quite on the edge of it, but we are still within the box. And so as long as your drilling goes through that, you should be okay when you place the implant. There again. And because this is a wider implant, you will have a few more drills, obviously. So the drilling protocol is extended. So we're just doing that. So basically during the surgery, you can actually calibrate each and every single drill. So here again, as you can see, we're right precisely in the middle of that box. And of course, you're drilling all the way up to depth. So the depth indicator just on the right of the bullseye, that's important as well, because you want to go as close as possible to the 0.0 mark. And then of course calibrate the next drill and carry on. That's what you're doing here, right? So this is the last one, last drill that you're going to go through, and then of course you place the implant at the end of the drilling protocol here. So again, as you can see, we go all the way up to depth. Perfect. We're within the bullseye as well, and now of course we will place the implant. The implant placement also, you can do it with the navigation system. You can also do it without. Some people prefer doing it without using the navigation. So it goes in all perfectly. And there you go. That's the placement of the implant. And of course the last step, once we've placed the implant, is your evaluation. As you can see, we've gone a little bit beyond where our planning was. Still well within bone, it's fine, and the angulation is only 4.2 degrees. So you've got an incredibly well placed implant. Yes, it's slightly subcrestal, but that will be okay in this case. Even prosthetically, that's not going to be a challenge, so you should be fine.